Acute myeloid leukemia, one of the toughest topic regarding its genetic. But in this lecture, we will try to cover all aspects of the acute myeloid leukemia and its genetic. So without wasting time, let's get started. First of all, we will see what is acute myeloid leukemia. We have to discuss its lineage. We have the most important stem cell, that is hematopoietic stem cell. It has two lineage. First is the common myeloid progenitor and second is the common lymphoid progenitor, which is not our concern. Our concern is common myeloid progenitor. From the common myeloid progenitor, you will see the three most important lineage: megakaryoblast, proerythroblast, and the myeloblast. From the megakaryoblast, you will see the synthesis of the thrombocytes, or you can say platelets. From the proerythroblast, you will see the formations of the erythrocytes, or you can say RBCs. And from the myeloblast, you will see the formations of white blood cells. And what type of white blood cell we will see later. So from the myeloblast, you will see the formation of promyelocyte, then myelocyte, metamyelocytes, band form, and then you will see the neutrophil, basophil, eosinophil. And another lineage is the formation from the myeloblast. You will also see the formations of the monocytes. These four white blood cells are synthesized or formed from the myeloblast. So actually problems or mutation happens in that can happens in the hematopoietic stem cells, that can also happens in the common myeloid progenitor, and ultimately you will see the proliferations of the myeloblast, or you can say blast cells, and ultimately you will see the leukemia. So leukemia can also disturb the platelets and erythrocytes also, because all platelets, red blood cells and white blood cell link to the common myeloid progenitor. That is our most important concern. Next, we will look at the classification according to the WHO, World Health Organization. First is the on the basis of genetic abnormality, what type of mutations happens, and as a result you will see the AML, acute myeloid leukemia. First you will see the T8 semicolon 21. What does it mean? It's mean translocation happens between the chromosome 8 and the chromosome 21. We have human has 46 chromosomes, okay, but in that case translocation means that segment or the gene exchange between these two chromosome number 8 and the chromosome number 21, and as a result you will see the fusion of the two genes due to the translocation, and that is the runx1, that is the first gene, fused with the runx1 T1, and ultimately you will see proliferation of the myeloblast. Next case is the inversion 16. It means that we have chromosome number 16 and the segment invert in it. That is the first case. And you can also see T16 semicolon 16. It means that translocation happens within the chromosome number 16. That is the important thing. And as a result, you will see the fusion of the two most important genes. These are basically the genes. CBFB, this is the gene 1, fused with the MYH11. This is the second gene. So these are the names of the genes, and these names are literally too much difficult. But you have to understand the concepts that is present in the genetics of the AML. Next is the T1517. It means that T for translocation. It means that translocation between the chromosome number 15 and the 17. And as a result, you will see the PML gene and the RARA gene. So this is the fusion of these two genes. Next, you can see the various mutations happen in that case, and ultimately you will see KMT2A genes mutated in that case. Next case is the T69 translocation between the chromosome number 6 and the 9, and you will see the two genes DEK and UP214. That is important thing. Next, similar case, inversion in the chromosome number 3 and translocation in also the 3 chromosome, and you will see the gene fusion GATA2 and the MECOM gene. Next is the T9 and 22 translocation between the chromosome number 9 and the 22, and as a result you will see the fusion of the BCR-ABL gene. Next, you will see the mutation happens in the genes, that is NPM1. So in that case, you will see the mutation, point mutations happens in the NPM1 gene. Next is the CEBPA gene, also mutated in that case. So this is the genetic abnormalities, and as a result, you will see the AML, acute myeloid leukemia. Next, myelodysplasia related AML. AML after the MDS, myelodysplastic syndrome. In that case, you will see the cell abnormalities. So what type of mutation you will see in that case? -5. -5 means absence of the chromosome number 5. Okay. And del5q. So before discussing this type of mutations, you have to understand chromosome has two arms, P and the Q. P arm is small, P is small, and Q arm is large. And at the center, you will see the centromere. That is important thing. In that case, -5 means absence of the chromosome number 5. And del5q means that Q arm of the chromosome number 5 is missing. It means that larger arm of the chromosome 5 is missing. Two case, complete absence of the chromosome number 5, or you can say Q arm of the chromosome number 5 is absent. Next case is the -7 mean chromosome number 7 is missing. Del7q means chromosome number 7 Q arm is deleted. Next, -17 means chromosome number 17 is missing. But in that case, I17q means that isochromosome. Isochromosome means that here is the 17 chromosome. In that case, both arms are Q. It means that P is missing in that case. So this is the isochromosome. Both arms are Q and P is missing in that case. Next, you will see del12p means chromosome number 12 having no P arm. P arm of the chromosome number 12 is missing. Next is the del11q. 11q means chromosome number 11 having no Q arm. Next, +8. +8 means that addition of the extra chromosome present, that is trisomy. +19 means extra chromosome has been added in that case. So these are the different types of mutations related to the myelodysplastic related AML. So in that case, you can also see the AML. And different types of genes, mutations happen in the different types of gene also. And that these genes are ASXL1. Second is the RUNX1, TP53, EZH2, SF3B1, SRSF2, and S stage 2, U2AF1, and ZRSR2. These are the different mutated genes, and ultimately you will see the formations of the AML. Next, you can see the therapy related AML after the therapy. What type of therapy? Chemotherapy, after the chemotherapy, you can also see the AML. And in that case, after the chemotherapy or radiotherapy, what type of mutation you will see? Missing of the chromosome number 5, minus 5. Minus 7 means that chromosome number 7 is missing. And TP53 mutation. TP53 is a gene and the mutations happen in it. And ultimately, you will see the AML. MDS, myelodysplastic syndrome, that is the abnormality in the cells, and ultimately MDS can convert into the AML. That is this after the cytotoxic therapy happens, and the mutation will be the similar. MDS and MPS, myelodysplastic syndrome and myeloproliferative neoplasm. In that case, these can also convert into the AML also, and this is also happens after the cytotoxic therapy. It means that AML can also see after the different therapy. Next is the not otherwise specifies NOS. It means that in mostly cases, mutations is normally unknown. First is the minimal differentiation. It means that myeloblast is minimally differentiated like myelocyte, metamyelocytes, band form, and the neutrophil. So in that case, very immature blast happens. So important thing you have to remember, in the bone marrow, you will see the blast greater than 20% blast, and these blasts suppress the other two lineage like the platelets lineage and the red blood cell lineage. So that is the important thing. Without maturation, it means that blast with myeloid marker. That is important thing. Maturation, you will see the blast cells along with the mature neutrophil, because some blast can be differentiated into the neutrophil as well, neutrophils and the different types of the white blood cells. Acute myelomonocytic leukemia. Myelo, that is the precursor form. Monocytic leukemia. It means that you will see the presence of the granulocytic and the monocytic leukemia in that case. Both types of the granulocytes and monocytes, because granulocyte you will see the neutrophil, eosinophil and basophil, and monocytes is agranulocytes. Next, acute monoblastic monocytic leukemia, that is related to the monocytes, because as we have seen, myeloblast forms the monocytes also along with the different lineage. So that is the acute monoblastic monocytic leukemia, monocytic. Pure erythroid leukemia, that is erythroid precursors present in it, because from the pro-erythroblast you will see the formation of the erythrocytes, and in between that you will see the different immature erythrocytes. Next is the acute megablastic leukemia, megakaryocytic lineage, also derived from the common myeloid progenitor as well. So all the lineage can be affected by the this one. Next is the acute basophilic leukemia, basophilic precursors in that case prominently seen. Next is the acute panmyelosis. All the lineage increase with myelofibrosis. Fibrosis form in the bone marrow. That is the fibrotic marrow along with the formation of the blast. And at the end, you will also see the myeloid sarcoma in this classification. So this is all about the acute myeloid leukemia and its genetic and its classification according to the WHO. If you still have any question, you may ask in the comment section. Thank you so much.